Hello everyone, I'm Kelly Barnett. Welcome to my channel Instant Healthcare, where I share simple tips, expert advice, and motivation to help you live a healthier, happier life. Today, we're going to delve into a topic that affects millions worldwide: arthritis. This condition doesn't discriminate. It can impact anyone, regardless of age, gender, or background. It's a condition that often creeps up on us, so recognizing the early signs is crucial for effective management. Early detection can make a significant difference in how well you can manage the symptoms and maintain your quality of life. We'll discuss those early warning signs, helping you take charge of your joint health. From stiffness and swelling to pain and decreased range of motion, understanding these symptoms can empower you to seek help sooner rather than later. Don't forget to like this video if you find it helpful, and subscribe to the channel for more informative content like this. Your support helps us continue to provide valuable information to those who need it. Your comments are always welcome, so feel free to share your thoughts and questions below. We love hearing from our viewers and are here to help answer any questions you might have about arthritis or any other health concerns. Let's work together to shed light on this common condition. By sharing our experiences and knowledge, we can support each other in managing arthritis more effectively. Whether you're newly diagnosed or have been living with arthritis for years, there's always something new to learn and ways to improve your quality of life. We'll also explore various treatment options, from medications and physical therapy to lifestyle changes and alternative therapies. Staying active and maintaining a healthy lifestyle can play a crucial role in managing arthritis symptoms. Diet and stress management are also important factors. Eating a balanced diet rich in anti-inflammatory foods and finding ways to reduce stress can help alleviate some of the discomfort associated with arthritis. Stay tuned as we dive deeper into these topics in our upcoming videos. We aim to provide you with comprehensive information and practical tips to help you live your best life despite arthritis. Thank you for watching, and remember, you're not alone in this journey. Together, we can make a difference and improve our joint health. See you in the next video. Arthritis might seem like something that only affects older adults, but the truth is, it can affect anyone at any age. It's more common than you might think, impacting millions of people around the world. What's even more surprising is that there are over 100 different types of arthritis. Each type has its own unique characteristics and triggers. Today, we'll focus on the common signs that can indicate the early stages of arthritis in your hands and joints. Arthritis often begins subtly, with symptoms that might be easily dismissed as everyday aches and pains. This is why it's so important to pay attention to your body and recognize the early signs. Early detection is key when it comes to managing arthritis effectively. By recognizing the early signs, you empower yourself to seek medical advice, explore treatment options, and make lifestyle changes that can help slow down the progression of the condition. So what exactly is arthritis? In simple terms, it's inflammation of the joints. This inflammation can cause pain, stiffness, and swelling, making it difficult to move your joints freely. Our joints are incredibly complex structures, allowing us to move and go about our daily lives with ease. When inflammation sets in, it disrupts the smooth functioning of these intricate systems. Section 5. Joint stiffness, the telltale sign. One of the most common early signs of arthritis is joint stiffness, especially in the morning or after periods of inactivity. This stiffness can be particularly noticeable when you first wake up, as your joints have been at rest for several hours. The sensation can range from a mild discomfort to a more severe, almost painful stiffness that makes it difficult to move. You might notice that your fingers feel stiff and achy when you wake up, making simple tasks like gripping a toothbrush or buttoning a shirt challenging. This morning stiffness is often one of the first signs that something might be wrong with your joints. Similarly, you may find that your knees creak and groan when you stand up after sitting for a while. This can make getting out of bed or rising from a chair a slow and uncomfortable process. The stiffness in your knees can also affect your balance and mobility, making it harder to walk or climb stairs. This stiffness is a result of inflammation in the joint lining, known as synovitis. When the lining of the joint becomes inflamed, it produces excess fluid, leading to swelling and pain. This inflammation can also cause the joint to feel warm to the touch and appear red or swollen. This inflammation can make movement feel restricted and uncomfortable, as the swollen joint has less space to move. You might find that your range of motion is limited, making it difficult to fully extend or bend the affected joint. This can impact your ability to perform everyday activities, such as walking, writing, or even holding objects. It's important to note that this stiffness usually subsides as you start moving around and your joints warm up. Gentle exercises and stretching can help to alleviate the stiffness and improve your range of motion. Regular physical activity is crucial in managing arthritis symptoms, as it helps to keep the joints flexible and reduces inflammation. If you experience persistent joint stiffness, it's important to consult with a healthcare professional for proper diagnosis and treatment. Section 6. Pain that lingers beyond everyday aches. While it's normal to experience occasional aches and pains, especially after exercise or strenuous activity, persistent pain in your joints is not something to ignore. If you notice that your joints are frequently painful, even when you haven't been particularly active, it could be an early sign of arthritis. This pain might feel like a dull ache, a sharp stabbing sensation, or a burning sensation. It can vary in intensity throughout the day, and might be worse after periods of inactivity or overuse of the affected joints. Section 7. Subtle swelling, a red flag. Not to ignore. Swelling in the joints, though not always present in the early stages of arthritis, is a red flag that should never be ignored. This swelling can be subtle and painless in the beginning, making it easy to overlook. Notice if your fingers appear puffy or if your knuckles look larger than usual. Swelling in the knees can make it difficult to bend or straighten your leg fully. Any noticeable increase in joint size should be checked by a doctor. Section 8. When movement becomes a challenge. As arthritis progresses, you might experience a decreased range of motion in the affected joints. Simple tasks like buttoning your shirt, opening jars, or gripping objects might become increasingly difficult. This limited range of motion is a direct result of the inflammation and damage occurring within the joint. It's important to address this early on, as it can significantly impact your ability to perform everyday activities. Section 9. Taking action. Steps to take today. If you're experiencing any of the symptoms we've discussed, don't panic. The first step is to schedule an appointment with your doctor. They can assess your symptoms, determine the underlying cause, and recommend the best course of action. In the meantime, there are a few things you can do to manage your symptoms and support your joint health. Gentle exercise, like walking or swimming, can help maintain joint flexibility and reduce stiffness. Maintaining a healthy weight can also take pressure off your joints. Section 10. Seeking expert advice. Your next move. Your doctor will likely ask you about your medical history, conduct a physical examination, and may order imaging tests like X-rays or MRIs to get a clearer picture of your joint health. Based on the diagnosis, they can recommend a personalized treatment plan. This plan might include medication to manage pain and inflammation, physical therapy to improve joint strength and flexibility, or lifestyle modifications to minimize stress on your joints. Remember, early intervention is key to managing arthritis effectively. Section 11. Living well with arthritis. A message of hope. Arthritis can be a challenging condition, but it's important to remember that there is always hope. With the right mindset and the right tools, you can manage your symptoms and lead a fulfilling life. While there's currently no cure for arthritis, the good news is that with early diagnosis, appropriate treatment, and proactive management, you can live a full and active life. Early diagnosis is crucial because it allows you to start treatment before the condition progresses. This can significantly improve your quality of life. Treatment options vary and can include medications, physical therapy, and sometimes even surgery. It's essential to work with your healthcare provider to find the best treatment plan for you. It's all about taking charge of your health and working closely with your healthcare team. Your healthcare team can include doctors, nurses, physical therapists, and even mental health professionals. They are there to support you and provide you with the best care possible. Don't hesitate to ask questions and express your concerns. The more you communicate with your healthcare team, the better they can help you manage your condition. Remember, you're not alone on this journey. Support from family and friends can make a significant difference. They can offer emotional support, help with daily tasks, and even join you in physical activities that are beneficial for your joint health. Support groups are also a valuable resource. Connecting with others who are going through similar experiences can provide comfort and practical advice. Millions of people around the world are living with arthritis, and there are countless resources and support systems available to help you thrive. Online resources, such as forums and educational websites, can offer a wealth of information and support. Many organizations provide educational materials, workshops, and even exercise programs specifically designed for people with arthritis. These resources can empower you to take control of your health and live your best life. Keep learning, stay positive, and embrace a proactive approach to managing your joint health. Educate yourself about your condition and stay informed about new treatments and strategies. Staying positive can help you cope with the challenges of arthritis. Regular exercise, a healthy diet, and stress management techniques can all contribute to better joint health. Remember, every small step you take towards managing your arthritis can lead to significant improvements in your overall well-being.